I started respiratory school in 2018, and then I started here as a respiratory therapy student in 2019. In 2020, I graduated, and that was during the heat of COVID, so I hit the ground running. And then after that, you kind of climb a clinical ladder here in the respiratory therapy department. So as a level 1 RT, you work with adults. As a level 2 RT, you work with pediatrics, and you can start doing charge duties where you're kind of in charge for the day of the rest of the people that are working in the hospital for that day. Level 3, you can start doing NICU, and then level 4 is part of our neonatal transport team. So I am now at a level 4. It's very rewarding, especially when you have like a lot of patients that we see regularly. They come back to the hospital often. You've got your COPD people that are dealing with lung disease, that they are in the hospital a lot. And then if you work all the way up to the NICU, we have a NICU reunion every year, which is kind of cool. So you have your NICU babies that you can spend weeks, even months in the hospital with. So it's really rewarding being able to see them after they've left here and see how good they're doing. So we're totally a family, we support each other. We have some respiratory therapists that have been here 40 plus years, so it kind of really does feel like a family. Like I have work moms and work siblings, if you want to call them that, and we are very supportive of each other, like I've already touched on a little bit. With that being said, because we have some RTs that have worked here for so long, there is a extreme wealth of knowledge within our department. So you always have people that have seen things that you've never experienced before. You're never doing anything alone. If you have something that, oh, I haven't done this in a long time, can you please help me? That's always an option. Somebody's always there to help you. Our leadership is always extremely supportive. So one of the things that you'll see when you become a respiratory therapist at Mercy is that we work really well as a team. Even though we each have our own assignments at the end of the day, we're always checking on each other, and that includes management.